I'm sure most people will have heard by now the tragic news about a young lady in England dying last week after having a Brazilian butt lift treatment performed. It is absolutely heartbreaking, and my condolences go out to the lady's family and friends. The reason I've just popped on now at the end of the day is I've not said anything publicly about this before, but the number of patients that I've seen today that have been talking about this poor lady and expressing their shock and horror that a beauty therapist was able to undertake a Brazilian butt lift treatment, and that a therapist that isn't medically qualified was able to perform such an invasive treatment. It's the stuff of horror stories, and we're sadly used to hearing of people having complications with cosmetic surgery procedures when they've gone overseas to Turkey and places like that. But this is the first death in the UK. And as saddened as I am about this, I am not shocked. In the aesthetic industry, we all knew that it would probably just be a matter of time before there was a fatality related to cosmetic treatments. Traditionally, a Brazilian bum lift, or BBL as it's been shortened to, was only performed by surgeons in a hospital. The patient would be under sedation under general anaesthetic, and fat would be taken from one part of the bodies, for example, the stomach or thighs, and transferred to the buttocks area. But more recently, and over the last few years, we've seen this BBL term be applied to a non-surgical treatment that's performed under local anaesthetic that sees the buttocks being filled with dermal filler. And it needs copious amounts of dermal filler to change the shape of a bum and to make it bigger. A couple of years ago, the British Association of Aesthetic Plastic Surgeons advised their members not to undertake this procedure as it was too dangerous. So why has this happened, and how has it been allowed to happen? The lady that passed away had a Brazilian butt lift treatment performed by a non-medic, and in England there is no regulation around non-medics. They can literally do whatever they want, and quite often they can go on a one-day course and leave that course with a piece of paper and a qualification that enables them to literally stick needles in people's faces the next day, or in this case, a lady's bum. Now, whenever the subject of medic, non-medic comes up, there's always someone that pipes up and says, I had a treatment done by a doctor or a nurse and XYZ went wrong. The difference between a medic and a non-medic is regulation. Doctors are regulated by the GMC, the General Medical Council. Nurses are regulated by the NMC, Nursing and Midwifery Council, and dentists are regulated by the General Dental Council. So, if you, as a patient, had a treatment with a doctor, dentist, or nurse and it went wrong, or you had concerns about the ability or the professionalism of the doctor, dentist, or nurse, they would be investigated by their regulatory body and, if deemed appropriate, would be stopped from practicing to protect you, the public. They would not be allowed to treat anyone anymore. Or sometimes restrictions are placed on their practice that might involve them having to have extra training or work under supervision for a period of time, all with the aim of protecting the public, our patients. Now, as I've already said, this man who has been arrested in relation to the lady's death is a non-medic. Now, there were concerns about this man's practice. In fact, you can see from this article he was exposed in an undercover operation as being happy to administer dermal fillers, lip fillers to a girl under the age of 18. And more recently, he was caught illegally selling prescription-only medication, a skinny jab, to members of the public. But due to lack of regulation, he was able to continue practicing. No one could stop him from treating patients. Had he been a medic, a nurse, doctor, dentist, and been caught illegally selling prescription-only drugs or administering treatments to minors, he would have been investigated by the regulatory body and quite probably struck off the register and unable to practice anymore. It really saddens me that it was known that this man was not safe to treat patients but was allowed to continue to do so. And that is only because of the lack of regulation in this country, and that's what needs to change. Thank you for listening. If anyone has any questions or would like me to explain anything in more detail, please get in touch. Either DM me or pop a comment below.